ADHD stands for Attention Deficit Hyperactivity Disorder. It is a developmental disorder that begins in childhood, but ADHD is much more than a child being energetic, and it is much more than simply not listening. But here is where parents can get confused. Almost every young child gets distracted. Sometimes almost every child can be impulsive or extremely energetic. That alone does not mean they have ADHD. With ADHD, doctors look for a persistent pattern. The behaviours are more frequent than expected. They interfere with the child's everyday functioning, and they appear in more than one setting. Let's start with inattention. A child might struggle to stay focused on activities. They may seem not to listen when spoken to directly or become distracted very easily. They may frequently lose things, forget everyday instructions or tasks, struggle to finish something they have started, or constantly move from one activity to another. Then there is hyperactivity. A child might constantly fidget or move around. They may struggle to stay seated when expected, or seem as though their body is always moving. They may talk excessively, run or climb when it is inappropriate, or find quiet activities particularly difficult. But remember, context and age matter. The third area is impulsivity. This means acting before thinking. A child might constantly interrupt other people or have significant difficulty waiting for their turn. They may grab things without waiting, blurt out answers before a question is finished, or make quick decisions without considering what happens next. These behaviours can affect friendships and school life. ADHD does not look exactly the same in every child. Some children mainly struggle with attention. Others mainly show hyperactivity and impulsivity. And some children experience both. This is particularly important when thinking about quieter children. A child does not have to be constantly running around. A child who frequently daydreams and struggles to focus can also have ADHD. And there is no single test that diagnoses ADHD. Sleep problems, anxiety, and learning difficulties can look similar. That is why professionals look at the whole picture. Parents and teachers may both be asked about the child's behaviour. For a diagnosis, symptoms must persist over time. They must cause meaningful difficulties in everyday functioning, and they need to occur in at least two settings, such as home and school. A qualified professional needs to make that assessment. So if you recognise some of these behaviours, do not panic. Look for patterns rather than isolated moments. If those patterns are persistent and affecting everyday life, seek an evaluation. Understanding what a child needs is the first step toward supporting them.